Let's go over some billing codes basics today, shall we? Welcome, I'm Martin Bruce, your medical bill whisperer. A previous billing manager turned patient advocate, I am committed to bringing answers, insights, and solutions to patients like you. So today, let's go over the basic code types and why they are so important, as well as identify potential problems. Everyone in the healthcare industry has and does use codes. Medical professionals, hospitals, insurance companies, of course, public health agencies, and more. Basically, anyone reporting a medical service, a diagnosis, an item, or a policy uses codes. It is the uniform classification of clinical data as well as demographic information. Claim forms are full of codes. Any entity or person reporting anything to a state or federal health agency must use codes. As for insurance companies, they cannot process or pay any claim without those codes. So let's start with the procedure codes. There are three. The first one is CPT. It is used to identify the medical, surgical, diagnostic services that you may receive. These 5-digit codes are issued by the American Medical Associations. A medical professional using a code to determine and get paid for services they have rendered must follow specific guidelines for each code they use based on circumstances, complexity of the problem, time spent with a patient or on the case, level of care given, and more. Here are some examples. HCPCS codes are issued by the Center for Medicare and Medicaid Services. Also a 5 alphanumeric code. It actually is for those services items that CPT did not cover. For example, some radiology codes, chemotherapy drugs, durable medical equipment and supplies, and more. The NDC codes are issued by the FDA for every drug out there, whether over the counter or that you receive through a pharmacy. NDC numbers are issued based on the manufacturer, the labeling, the dosage, the size of the packaging, etc. Diagnosis codes all fall under ICD-10, a series of numbers and letters that indicate parts of the body as well as extremely accurate and detailed descriptions of symptoms, diseases, etc. ICD-10 codes must be to the highest possible level of accuracy. And we'll get to that a bit later. Codes that are deemed unspecified may not be covered. Other codes are for the place of service. Those are only 2-digit, and they refer to where services was actually rendered. Was it at a neighborhood clinic, in an office, as an inpatient hospital, ER, etc. Providers must also reduce themselves to codes, including the tax ID number. That determines who should get paid by an insurance, but also whether the claim will be processed as in-network, if there is a contract and therefore a discount to you, or out-of-network, no contract, and you pay more. The second code for providers is called the NPI. It is an individual number that indicates on a claim form who is the actual person rendering the service, not who gets paid. Now, many issues can arise because of codes. A common one, unfortunately, is just a stupid error, a Z instead of a 2, an O instead of a 0, and so on. Codes that don't match will result in rejections of claims and denials of payment. The procedure must match the diagnosis and must match a place of service. It all must make sense. As for unspecified codes, they are often rejected, especially if another code is available that is more accurate. For example, if the side of the body is not indicated when it should, or the description is too general. Miscodings happen as well and will result in denial. For example, inclusive codes, those that have been deemed to be part of the main procedure. Unbundled, same thing. A surgeon would not charge for opening you up, looking around, fixing whatever needs to be fixed, and closing you up. All of these fall under surgery. And some codes, CPT or HCPCS codes, will require units or modifier that indicate either specific lengths of time or specific circumstances, such as emergency. Without those modifiers or units, claims cannot be processed. Most helpful tip I can give you today is always to get codes, not descriptions. If you're calling your insurance to see if a service is covered or at what rate, if you ask for an authorization, if submitted for reimbursement, descriptions are not payable. I so thank you for watching. Your likes, comments, and subscribes help this channel grow to reach out to more patients like you. So if you find this information useful, and thank you for subscribing.